Tip number 6. Select exercises based on risk and movement competence. Exercises can progress as your movement competence progresses. We discussed in tip number 3 how adult spine modifiers increase your risk for pain and disability in the future. Simple tests using a scoliometer and plumb line can easily be done by your fitness or healthcare provider. In tip number 4, we discussed the importance of a movement assessment of your balance, strength, and flexibility. This also highlights your ability to stabilize your curve transition points and determines if you are a competent mover or challenged mover. As an adult with scoliosis, this table can act as a guide for your exercise selection and advancement. Each column of photos represents a category of exercise. The stability category contains mostly exercises that promote stabilization of the spine, including curve transition areas, since scoliosis is primarily an instability disorder, which we discussed in tip number 2. The controlled movement category includes mobility exercises for those without modifiers who are competent in demonstrating curve stability. Exercise selection should be based first on your risk factors due to the presence of adult spine modifiers, and then on your movement competence. If you have adult spine modifiers and are a challenged mover, then prioritize basic spine and curve stability exercises. Having spine modifiers is a risk factor, especially if you have a lumbar curve due to the instability at the lumbosacral junctional curve, which has been described in previous tips. If you have adult spine modifiers but you are a competent mover, then choose exercises that prioritize basic spine and curve stability, and you may quickly progress to advanced stability exercises. Your exercise selection should continue to prioritize spine and curve stability due to your risk factors, which increase the difficulty of stabilizing hypermobile transition areas of your curves. If you currently have no adult spine modifiers but are a challenged mover, your first exercises may come from either the basic or advanced stability category. This dotted line is transitionary to show that as you become a competent mover, you have the potential to progress eventually to controlled movement exercises due to your lower risk. If you have no adult spine modifiers and are a competent mover, then you may select exercises from all categories. Having a risk and movement assessment provided by your fitness or healthcare practitioner will help you select and advance your fitness exercises. Stay tuned for tip number 7. Thank you.